Thank you for giving me the chance to speak with you today. I'd like to reflect on our long-term journey to an integrated health and social care system, the challenges that this year continues to present, and what might come next. COVID remains a huge challenge for Wales, and one that I believe that we have risen to. Integrated working has been more important than ever before. The crisis has powerfully demonstrated the ability of health and social care to work as one integrated system. It is essential that we build on that moving forward. I published the long-term vision for our health and social care system in A Healthier Wales just over 2 years ago. I want to reflect briefly on our progress with that plan. The COVID-19 pandemic has had a profound effect on the delivery of public services, as well as changing the behaviour of the public who access that care. However, I do believe the vision set out in A Healthier Wales remains both sound and even more relevant. It has remade the case for reform. The main elements of that vision are a whole system approach where seamless support, care or treatment is provided as close to home as possible, where services are designed around individuals based on their unique needs and what matters to them, as well, of course, as quality and safety outcomes, where people will only go to hospital when it is essential, with services designed to reduce the time spent in hospital, and where more local services are available in community settings to allow people to access a wider range of advice and help more easily. I'm pleased that a growing number of health and wellbeing services are already moving closer to people's homes in line with that vision and our long-held ambitions. I'm grateful to the many people in the social care sector who are already working hard to achieve this. Another sector, I know that you've learned much from the use of technology as a key part in the COVID-19 response, helping to provide alternatives to face-to-face consultations, reducing the need for travelling and keeping people in touch with one another. It is critical that social care and health professionals continue to support people in their own homes, hospitals, care homes, supported accommodation and other settings. We need to build on new ways of working and innovation, including, of course, the innovation and change that have been forced and advanced by the need to respond to the COVID pandemic. Whilst thinking about and continuing to manage our pandemic response is, of course, crucial, it is essential that as a system we do not lose our focus on the future. And there are two particularly critical issues. Firstly, the resources for the social care sector to meet increasing needs. And secondly, whether the way that the sector is arranged gives us the strongest possible future. I'm on resources, and I know the Deputy Minister will touch on the futures agenda in her contribution to this conference. Like other parts of the UK, the number of older people in Wales is projected to increase significantly over the next 25 years. It is, of course, a success story that more of us are living longer. But if we want good quality care and support for an increasingly older population, we will have to consider the resource to deliver that. I chair an interministerial group within the Welsh Government that is looking at how we could meet this challenge. The ministerial group is supported by a programme board, which includes representation from ADSS Cymru and the Welsh Local Government Association. We've commissioned expert advice to help give a firmer handle on the funding required to maintain the current level of social care. One report we received presented 5 possible funding scenarios, projecting need by 2022 to 23, ranging from an additional £35 million a year upwards. Assuming council tax uplifts and Welsh Government provision for local government rise in line with inflation, it would be possible to broadly manage all but the highest cost scenario to maintain the current level of care. In line with Prosperity for All, which commits us to developing innovative funding models to ensure additional funding is available to meet these challenges in the long term, we've been exploring options including a levy or taxation to help fund future social care in Wales. We've considered a wide range of options for the potential use of any additional funds that we could generate. Our shortlisted options focus on the three key areas of offsetting social care charging, investing in the workforce, or investing in accommodation-led models of care. I know that the resounding view of the social care sector is that investment in the workforce is essential. Workforce recruitment and retention is a major challenge, and any action we could take in line with the Welsh Government's Fair Work agenda would have a number of benefits. Ministers will shortly consider the outcome of detailed work on charging and workforce options. In considering how to take this important work to the next stage, the context is, of course, an ever more difficult financial environment. We also need to understand what measures the UK Government might take. It would be preferable if we could work in a joined-up way on this hugely challenging agenda. However, the last decade and more does not give much cause for realistic optimism that the UK Government will address and significantly fund the social care challenge. There is, though, the will within the Welsh Government to address these issues, but the financial means, particularly because of the pandemic, remains really challenging. The main message from me to you is that as a government, we do understand the funding challenges facing the sector. We've been actively working on the best means of addressing them. And what we can do going forward will depend on the broader fiscal environment as we emerge from the coronavirus pandemic. I look forward to continuing to work with the WLGA and ADSS Cymru on this agenda in the time ahead. In so many ways, our biggest and most important resource isn't money, it's our social care workforce. Our health and social care workforce has never been more important to society's well-being. I'm very pleased that I've now been able to launch the joint HIW and Social Care Wales workforce strategy and 6-month delivery plan. And I want to acknowledge a huge amount of work that has gone into its development, including a great deal of engagement with colleagues and partners across sectors. We know that the strategic themes identified in the workforce strategy were important before the COVID-19 pandemic. So now, as we renew our efforts to tackle the current wave of the pandemic. The strategy signals our ambition to value and support our workforce, engaging and motivating with compassionate leadership and the opportunity for our workforce to develop their own skills. It's important to maintain our focus on this long-term ambition, even as we tackle the immediate challenges of this winter period. Workforce wellbeing is a real concern at this time. Social care workers have contributed a huge amount to society over the past months, and we need to provide them with support that they both deserve and need over the coming months and years. I'm confident that this new strategy will help us to do that. I'm pleased that alongside this work, Social Care Wales has joined the Social Care Forum, which is taking forward a range of work to help improve the terms and conditions of the workforce. It's good to see that all these different pieces of work are coming together, and ultimately, we ought to make a significant difference with and for our social care workforce. Of course, we continue to face the significant challenge of leaving the European Union transition period. We continue to face a hugely uncertain future. However, we are continuing to engage with partners across the whole of social care to help us to find a path through the challenges that lie ahead. Alongside substantial work being done to secure the flow of crucial medical, disposables and clinical consumables, we continue to make representations around immigration policy and social care. Regardless of the palace politics in Westminster, we will continue to make the case for Wales, and social care is very much a part of that case for Wales. Once again, I want to thank you for your time today, but in particular, everything that you have already done to make a difference to so many people right across our country. If nothing else, I believe this pandemic has highlighted the role and the importance of social care in a way that we haven't managed to do in the past. I hope that moment isn't just a fleeting one, but a much bigger and more significant public recognition of the value that all of us should place on social care today and our collective future. Thank you to each and every one of you. I wish you a successful conference and more success in what is still an uncertain future. Many thanks.